Hey there, nursing family. Christopher here, the PD nurse. First of all, I hope that y'all are staying safe and doing well, taking care of yourself during these very difficult times. And I just want to say that I'm so proud to be a part of this community as we come together to care for our patients, because it's really one of the best things that we could possibly do. So I want to kind of have like a chat to chat and talk a little bit about something that over the last kind of like few days is really starting to kind of bother me, and I thought I would just share it with you. So in the early days of COVID, kind of everyone raced to provide information through videos. And I remember being asked by either friends, family, or colleagues, hey, are you going to make a video about COVID for the PD nurse community? And at the time, I had already made a conscious decision to say no, I wasn't going to make a video about COVID-19 because there was already so much information streaming in. And then, quite frankly, we didn't even know a whole lot about COVID-19 that I wouldn't even know what to talk about. And so I didn't really want to add to the additional large amount of information that now everyone already had to kind of wade through. I really was just looking to the experts for the advice that we needed, such as those that came from the CDC, the World Health Organization, or the NIH. However, I will say that as the US has kind of worked to establish this concept of social distancing and flatten that curve, I have actually heard or come across a lot of misinformation, disinformation, or maybe just general misunderstanding of the current information that we have about COVID in children. And I really wanted to kind of talk about that for a minute. Some of the things that I recently just heard was that children can't get COVID-19, or if they did, it was a weaker version of COVID-19. And I think that's just a misconception about what it means to have mild symptoms versus what a weaker version might look like. And then just along with a bunch of different variations of COVID-19 and these concept of social distancing, children can't play indoors, but they can play outdoors because of fresh air and things like that. And so as I was walking home last night from work, and I had a really, past long, busy couple of days as we all have as nurses, I kind of felt this need to provide our community with the most up-to-date information and stats so that we as nurses can then educate and correct any misinformation within our own respective communities. Okay, so for starters, children can and will get COVID-19. And in fact, on March the 16th, a couple days ago, in the Journal of Pediatrics, Dr. Wai Dong of China, he actually published his initial findings of COVID-19 in the pediatric population. And he did note that there was this puzzling and unexplained differences that have occurred with COVID-19 infected children versus adults. However, still the bottom line up front reality is that children will and can get COVID-19. So here's some initial numbers from his study from mid-January to the end of February that were found in China, and I thought it would be interesting to talk about. So 4% were of asymptomatic children. 51% had mild illnesses. 39% had moderate illnesses. 11% actually had severe illnesses, and actually only one child died, and he had a comorbidity or additional problems that COVID exacerbated. Dr. Dunn also did notice, though, that of those children infected with COVID-19, and had severe and or critical infections, 11% were infants. So when you kind of break these numbers down, between the ages of 1 to 5, it was about 7% of critical needs, 4% 6 to 10, and then 3% of the 11 to older adolescent children. Now, Dr. Cruz of the Baylor College of Medicine and Dr. Zeichner, I hope I'm saying that right, from the University of Virginia's Department of Pediatric and Microbiology, Immunology, and Cancer, in a pre-publication article in the American Academy of Pediatrics, suggest that while children are less likely to become severely ill as adults, as noted in Dr. Don's and early observations, there is still an increased risk to a subpopulation of pediatric patients, particularly those that we call medically fragile, right? Who can, on top of their already deteriorated medical conditions, can develop severe disease. Now, in a Norwegian study, about 10% of children at that time that were hospitalized were all positive for COVID-19. So that means that when testing came available, they actually tested all of the children that were currently admitted for something like respiratory distress. And then when they tested them all, 10% of them actually also had COVID. It has been also suggested by experts that children play a really major role in the community-based transmission of COVID-19 and through nasal and what we're starting to learn is fecal shedding. And they've also recently have found that those who have had rhinoenteritis or co-infection of rhinoenteritis were most susceptible to COVID-19. Now, particularly during asymptomatic shedding, which is actually more of the bigger problem, because that's going to be likely the one to perpetuate the epidemic within any given population. So I want to end this chat with this kind of, this very important concept. We know that children can and will be infected with COVID-19. Children will serve as a vector for transmission of COVID-19, even during this time of social distancing. This also means that children should be participating in social distancing. It's amongst not just indoors and outdoors, like completely, like they should be staying home with their family units, practicing clean hygiene. Especially that they should be taking some time to separate themselves from those that are at risk, such as like grandparents or the elderly population, as well as any medically fragile children that they might be coming in contact with. And so as a pediatric nurse, we have to be able to educate our community about misinformation and then empower our parents with current information that is going to help protect themselves and their families. So I encourage you all to seek reliable health information, such as the American Academy of Pediatrics healthychildren.org, to learn more about COVID-19 and children, and I would even recommend that to parents. Okay, y'all, thanks for listening to my rant. If you have any questions, comments, or you just like to share some additional information, put those comments in the below, because we together as a community need to come together and dispel misinformation and empower our community to be on the right track. Until next time, y'all have a good one. Bye.